Thanks, David. Thanks for that introduction. So I am Adam Nice. I'm the Senior Policy and Public Affairs Officer at the Mental Health Foundation. I'm going to give a quick overview of what the Mental Health Foundation is. I'll talk through body image and why we're interested in it. And then I'm going to get on to 5 or 6, I think, policy areas that I think are important to tackle when we're thinking about improving people's body image. So first of all, the Mental Health Foundation is a public health charity that focuses on mental health. Our primary interest is on preventing mental health problems before they reach the point of clinical need. And therefore, we're looking at things like body image, so those risk factors that cause people's mental health to deteriorate or make people struggle with their mental health. So we came across body image, I think initially, actually, we run Mental Health Awareness Week every year, and we ran one on stress. And one of the major stresses that came through was people's body image. And we felt that was worthy of further investigation. So in another Mental Health Awareness Week, this time in 2019, we decided to do that as the topic and provide some research and policy and really work on that topic. And it's ended up being one of our most actually successful policy areas. There's a lot of appetite to talk about it and a lot of appetite in government to do something about it, which is very encouraging. But what we found during the week was that while about 21% of adults felt satisfied with their body image, in that year, 1 in 5 people, 20%, had felt shame, and just over 1/3 had felt down or low in the past year because of their body image, which is clearly quite a high number. And shockingly, 1 in 8 adults as well felt suicidal feelings relating to their body image, which is very high. Negative body image is really about internalizing a conception of an idealized body image that is different from one's own. And this can cause kind of internal strife that leads to feelings of depression or anxiety and can really affect people's lives if they don't want to be going out or are afraid of exercising in public, for example. So there are mental health and physical health outcomes from this. Body image, as I'm sure you're all aware, is influenced by a variety of things. So we're looking at things like relationships with our family and friends, how our family and peers feel and speak about our bodies and appearance, exposure, particularly to images of idealized or unrealistic bodies through the media or social media, and also pressure to look that way and to match an ideal body image. As a public health charity, we're often looking at things through the lens of inequality groups or groups that are more likely to be unequal in an area, such as body image. So I'm going to quickly run through a few of those before I get on to the policy areas proper. So I think intuitively, we all know that gender is a factor, and women and girls are certainly more likely to report being unsatisfied with their bodies. There is increasingly an understanding that it affects men as well. And a 2016 survey actually found that 10% of secondary school boys have said they skipped a meal to change how they look, and 10% again would consider taking steroids to achieve their goals. And it's these kind of different presentations that I think we're becoming a bit more aware of relating to gender. And as well as that, pregnancy is actually a time of heightened risk. When we've been able to do a bit of qualitative work, that's something that's come out a lot. It doesn't come up necessarily as much in large-scale surveys because there's not often enough people who are pregnant or have been pregnant in the survey sample size. But in the qualitative work, that's come through quite strongly. People feeling that their pregnancy is affecting how they feel about the way that they look. Another area where people experience inequalities is race. I'm not going to speak to this one too much since there's a later speaker on the topic. But in this area, if there is a more dominant culture and race presented on screen, for example, people can end up feeling unrepresented. This can go kind of one of 2 ways a lot of the time. It can make people feel excluded and therefore upset about their body image, and things like skin lightening is something that we come across. But it can also be kind of a protective factor, because if the dominant idealized body image is not one that you are ever able to achieve, it might not be something that you are aspiring to. And equally, people from different cultural backgrounds might actually have different internalized body images, especially if their parents are a big influencing factor. So we've heard that quite a lot about race in some of the in some of the qualitative work that we've done in different cultural groups. Moving on to age as an inequality group, people being of older age is generally a protective factor. Although for the people who are affected by body image in later life, generally their concerns are around the visible signs of aging, as you might expect. Younger people, conversely, are generally more affected by body image concerns. And there's new concerns around social media and growing up online that certainly presents an interesting area of study. And I'll get onto some of that a bit later on as well. However, children often talk about the impact of their parents, especially, as well as peers and teachers. So it's not just a case that children now growing up online, so the pressures are wildly different. They still have those kind of traditional stresses on body image, in addition to the social media, which often also intersects with some of those things like peer pressure, because it's just a lot more constant and visible. Sexual identity is something we also investigated during that Mental Health Awareness Week, and people from sexual identity minority groups or LGBTQ plus do feel more pressure on their body image, and there needs to be a bit more research, I think, particularly in the area of trans body image. There was not a lot of that at the time that we did our research, so a bit of a gap there. And finally, on inequality groups, disability and long-term conditions is another group that feel underrepresented on screen and often presented in unflattering ways when they are presented, and obviously different to the kind of hegemonic idealized body image that you can probably imagine when you're thinking about what that is for us in the UK. So the policy areas that I would like to cover today are advertising, image editing apps, online safety, cosmetic surgery and non-surgical cosmetic procedures, education, and finally, healthy eating. So these are some areas where we've felt it's been possible to talk to the government and to get some action, and where we've had a bit of success as well, fortunately. So I'm going to start with advertising and body image. I think this is an area that we intuitively know is often bad for our mental health and for our body image. In the survey we ran for Mental Health Awareness Week, around 1 in 5 adults, 21% I think, said that images used in advertising and images used on social media cause them to worry about their body image. I think 40% of children found social media, or adolescents, sorry, found social media to be particularly a problem. The thing with advertising is it uses images to create an aspirational version of the world. It tries to create a mismatch between what a person wants, what they're aspiring to, and what is actually achievable. And kind of maintaining that gap between desire and possibility is often where they can situate their product. So if you're selling a cosmetic product, for example, you're wanting someone to not like the way they look in order to sell your product as a solution a lot of the time. But even when advertising is not doing this, they're often trying to create a vision of a perfect world, which their product is obviously contributes to or is situated in. But it often uses those idealized body images to achieve that impression, even if it's not necessarily related to the product. And this means you get a really wide range of advertising that can be harmful to body image. And when we spoke to a young people's focus group last year, I think, about advertising, it was quite surprising that the things they felt harmed their body image or that they were concerned about wasn't just the usual suspects in terms of cosmetics and body weight loss and things like that. It could be almost anything. And that's something that I think really needs to change, because there's a clear financial incentive for advertisers to really damage people's body image, because it makes people more wanting to try their products or wanting to do something different that they'll be willing to pay for. So in the advertising world, the main regulator is a self-regulator. It's the Advertising Standards Authority. They've been pretty good on body image in general. They do have some guidance relating to body image and some body image related areas, specifically non-surgical cosmetic procedures and weight loss products. However, they have found they are getting quite a lot of complaints about advertising that harms people's body image regardless. So they have consulted, and we're waiting the outcome of that consultation on what body image, how they could better regulate around body image. What we said in that consultation was we think they need to take a wider view of what body image is. Currently, they are only looking at body image as images that appear unhealthily thin, which is, of course, an important part of negative body image, but it's not everything. So we want them to take a wider view of what constitutes body image harm. And we'd also like to see it written specifically into their codes to make sure that advertisers are totally aware that body image harm is an unacceptable harm that they should be seeking to avoid. In addition to the Advertising Standards Authority consultation, there is also a new online advertising program. This is part of the Online Safety Bill, and it aims to make more parts of the advertising ecosystem online accountable and covered by regulation. At the moment, there are a lot of intermediaries that facilitate particularly the targeting of advertising online. It's not covered by any regulation at all because they're different to offline advertising, and therefore just haven't been covered. The legislation hasn't caught up. So this legislation is aiming to catch up with where we are online and make sure that all parts of the advertising ecosystem are accountable for what they're doing. They've offered a couple of different models of doing that. One, the most likely, I think, is what they call a hybrid backstop model, which is where they'd have a newly appointed regulator who would provide additional enforcement powers where it's needed. The issue with the ASA is it's an industry self-regulation model, so it does need people to be bought in, and the people who are already bought in, the ones that are regulated, but these intermediaries and other actors online aren't a part of the regulator. They don't have any enforcement powers. So a new statutory regulator with statutory enforcement powers would be helpful to back up those areas where the ASA has no sway, essentially. They're also considering an entirely new regulator for online advertising that would replace the ASA. In some ways, this would be the ideal solution because the ASA is always going to be primarily a self-regulator. The backstopped areas would be quite extreme, likely, whereas an entirely new regulator could be a bit more interventionist. But you'd be losing all the expertise that the ASA has built up. You'd have to take time getting up to speed. So that is something they are currently balancing. I should mention as well on advertising some positive industry action, because it's not just external actors like us. There are advertisers themselves who are trying to do better. A good example is the Dove body image pledge called Be Real, and their aim is to get more unedited images on screen, and they've done a very good job of doing that themselves and are trying to get other industry advertisers online. There's also quite an active MP in this area called Dr. Luke Evans. I'm going to talk about some of his work in a later section, but he also now has a body image pledge where he's trying to get companies to sign up to not use edited images on their websites, for example. And I think when we've spoken to people in a qualitative setting about advertising and body image, their greatest desire is to see a greater diversity of body images presented in a positive light, especially. So what that means is not just necessarily more people from ethnic minority backgrounds, for example. We're not making progress if we just see an unattainable idealized body type for every minority group, but we'd like to see diversity in that way, but also in terms of face shapes, body shapes, skin tones, skin flaws, disabilities, all of that. So the idea is that a greater range of body shapes are seen as acceptable and desirable, but particularly acceptable. That's it on advertising, I think. So I'm going to move on to image editing apps. This is quite a new area of study and one that the foundation's been quite active in leading, actually. We ran some research on this, and there's a research briefing that you can find on our website. Image editing apps are now widely available. To give you some examples of what they can do, they can use filters to improve your skin quality. I think actually Zoom has this feature. You can just choose to have your blemishes removed and appear all soft focus. But people can also do things like apply filters to mimic having cosmetic surgery. We have heard anecdotal evidence of young people turning up at cosmetic practitioners asking to look like a filtered version of themselves, which is clearly quite concerning. And what we're looking at doing in this area primarily is restricting the availability of these apps to young people. We've looked at restricting them through App Store providers. So the Google App Store and the Apple App Store, Google Play Store, sorry, and the Apple App Store, their terms of service should really be adjusted in light of these findings and the dangers that image editing apps can cause to young people's body image and mental health. There's also another way of approaching this that I wanted to talk about a little bit. There are digitally altered images, and these digitally altered images people think can be labeled to make people more aware of the problems that they cause. The MP I mentioned earlier, Dr. Luke Evans, is a big advocate of this. I just wanted to bring this up because there's not really evidence yet to support this approach. There have been some experimental studies that have suggested that there might be actually additional harm from labeling digitally edited images. if someone's aware that an aspirational image is literally not achievable, they may feel worse about not being able to achieve it. And also these images tended to build trust in the brand, making them seem more apparent, transparent and trustworthy. However, one note I would say is that because these are just experimental studies and there's a lack of real world data, it may obscure harm reduction in other ways, like you might see companies modifying their behavior to avoid having to put a disclaimer on their images, and that might be a way of reducing harm. And because this is an achievable goal with good political capital behind it, actually, and there are examples of countries doing it, including Israel, France, and most recently Norway, potentially the best thing to do here might be to find a way of making labelling work rather than write it off because of these experimental studies that haven't shown it to work yet. So that is something to think about, something I don't think we have a clear line on in the foundation yet. I'm going to move on to online safety, which is kind of a related area. There's a big online safety bill at the moment, which is aiming to improve regulation online. Body image harms kind of fall into a grey area of legal but harmful, which is a lot more difficult to legislate for, and is also fairly unlikely to be a priority early on. They'll be looking at things like terrorist promoting content and suicide promoting content, which are things that are clearly illegal and also harmful. But there's certainly a potential to use the online safety bill to favour certain types of content and to discourage things that are harmful, especially through their proposed code of conduct for social media platforms especially. I'm going to talk about cosmetic surgery and non-surgical cosmetic procedures a little bit, because this is somewhere that has been particularly badly legislated for so far, and I think is a big factor in a big driver in causing people to want to look a really similar and non-diverse way. It makes it possible. So it is an industry based around altering people's appearance, and it does carry incentives also to make people dissatisfied with their appearance. And as a result, there are some quite worrying developments like a desire to trivialize non-surgical cosmetic procedures. The industry has started describing some treatments as tweakments. They want to make them appear to a similar level of routine as having a haircut or getting your nails done or something like that, despite the quite real physical and mental health dangers that they do carry. Mental health harms can come from potential physical harm, from a botched procedure, for example, and difficulty of getting recompense because there's not a good way of doing that currently. Non-surgical cosmetic procedures are also, as I said, an incredibly poorly regulated space. A large number of procedures can be done anywhere at any time by any person. And there's poor practice around asking for proof of age at clinics. It's very easy to find examples of Botox being advertised to consumers online, which is not allowed because it's a prescription-only medication. So even where there is regulation, it is not well enforced. There's no central register of practitioners, no mandatory training, plenty of unaccredited courses, no professional indemnity or insurance, no helpline or clear advice if something goes wrong, and a lack of psychological screening and questionnaires are often not impartially administered. So the policy solutions that we've been looking at here kind of fall into safe products, people and premises, which is from an earlier review that the government had carried out into this area but not really acted on, and better enforcement of existing rules through mechanisms like the online safety bill, for example, and the online advertising programme, thinking specifically about the advertising of Botox, for example. I'm running out of time a little bit, so I'm not going to talk about education too much because my colleague is speaking about that next. I just want to raise here that young people are often targeted for education, but it's not just about young people. Parents and teachers need to understand about the effect that their words, language and approach can have on their children's body image, and we found that parents were a really big cause of young people's body image distress. So education for children, but adults as well, ideally. So finally, in my remaining couple of minutes, I wanted to touch on healthy eating. I think this is an interesting area for body image because there's a real tension between the government's desire to lower obesity and promote healthy living, but also balancing that with tackling body image concerns. And I think they're getting it a bit wrong at the moment. There's plenty of research showing that body shaming and weight shaming is counterproductive to achieving weight loss and also dangerous for people's body image and mental health. Yet the government's approach could be considered fairly stigmatizing as it stands. There's been no formal evaluation of the government's obesity strategy, and third-party research has shown generally negative outcomes from it. And the decision to include calorie labeling on menus has been widely panned, for example, in the Women and Equalities Committee report on body image. Calories reduce food to a number and potentially promote an unhealthy relationship with food. The number that food is reduced to is not necessarily that meaningful anyway. The calories in an avocado, while greater than, are not really comparable to the calories in a 25-gram packet of crisps, for example. It's not promoting healthy eating to say, just go for one with the fewer calories. And for people with eating disorders, calorie labeling is potentially extremely dangerous. So not clear why that policy has gone ahead, and that's something that we would challenge. So some policy solutions we think about in this area are an obesity strategy that focuses on positive promotion of healthy lifestyle choices, but more importantly, an obesity strategy that tackles the environmental and social factors behind obesity rather than stigmatizing the people that have become obese for some of these reasons. Thanks, that's everything I wanted to cover today. So I hope you found that talk helpful, and I'll pass on to back to David to introduce the next speaker.